Good morning. My name is John Kinseth. I'm the Deputy City Manager of the City of Decatur. Today is Friday, April 24th, 2020. At yesterday's press briefing, Governor Pritzker indicated that he will extend the stay-at-home order through the end of May, with some changes. Most of the changes relax previous restrictions, with the exception that face coverings will now be required when in a public place where it is difficult to maintain social distancing, such as retail stores. Beginning May 1, with the new executive order, we anticipate outdoor recreational facilities such as golf courses and state parks may start to reopen, along with other non-essential retail stores being allowed to fulfill phone orders, online orders through outside curbside pickup. Some additional business categories will also be considered essential under the new order, such as garden centers, nurseries, and animal groomers. Elective surgeries will also begin to resume at our local hospitals. If you're not feeling well, if you have any type of medical issue, now is the time to start to re-engage with your doctor at those hospitals. Please take note of the new state requirement to wear face covering in public places. As we begin the process of slowly reopening our local economy, it is as important as ever that we maintain the CDC guidelines for social distancing, for face covering, so that we do not lose ground on the slowing the spread of the COVID-19, lest we risk another economic pause. Nobody wants the economy to get shut back down the way it has been over the last month and a half and the way it will be over the next month. It is more important than ever that we slowly and responsibly open up our businesses while maintaining the face coverings, the social distancing, and all the other guidelines to keep ourselves safe so that the numbers are manageable for the local healthcare system. Also, please know that while I'm not a doctor and a healthcare worker, I do want to clarify for residents that there are no household treatment or cure for coronavirus. Please do not inject or ingest household chemicals or cleaners, as they are likely to cause more significant damage or death than the virus itself. Yesterday, Congress passed an additional stimulus bill which replenishes the Payment Protection Program, which is intended to help small businesses. I urge all Decatur businesses which need financial assistance to get their application in for this program before it again runs out of funds. Thank you, and have a good day.
Hello, I'm Dr. Mark Scott. I am a family physician in Decatur. I've been practicing since 1992 in Decatur, and I'm also the medical director at the SIU Center for Family Medicine, Decatur. And in the 28 years I've been practicing, this COVID-19 pandemic has certainly, I think, created the most challenging 2 months in healthcare that the system has faced, and I think most healthcare workers would agree with that. And perhaps the biggest challenge that we face is the amount of information that we are constantly presented with, new information, and some misinformation. And so I wanted to take a few minutes today to talk about some of the myths and facts about COVID-19 that are out there. The first thing I wanted to say is that we are all at risk. COVID-19 is not a worry just for certain members of the population, such as the elderly or those with underlying health conditions. Certainly, those citizens are at the highest risk of COVID-19, but we are all at risk. There are almost 1,000 cases in Illinois right now that have been identified in individuals who are under the age of 20. And in the age group of 20 to 29, there are almost 5,000 individuals now identified in Illinois who have tested positive for the illness. So we're certainly all at risk, and even those that are young and without health conditions can be severely affected, can be hospitalized, and there have even been deaths reported in individuals who don't have any underlying risk factors. So we all need to continue to take this seriously. The number of cases has actually increased over the last 2 days in Illinois. We had over 2,000 new cases identified on Wednesday of this week, and 1,800 cases identified yesterday. In Macon County, we continue to see a rise in cases. We are up to 96 as of yesterday in Macon County. And we saw a rise this week of 37 cases just in one day, a couple of days ago. So this is something we all need to continue to take very seriously. We are by no means close to being over with this pandemic. So let's all continue to practice our social distancing, staying at home unless it's absolutely necessary to go out, and performing hand hygiene and wearing masks when we're out in public. Those are all things we need to continue to do. The second thing I'd like to talk about are some medications that are prescribed and available over the counter, and some of the misinformation that is out there about that. The first category of medications I'd like to talk about are called non-steroidal anti-inflammatories. These are drugs that are used to treat arthritis and other inflammatory conditions. Ibuprofen is an example of that. Early on in the pandemic, there were reports that taking these medications could increase your risk of contracting the disease or making the disease worse. As of today, the CDC has reported that there is no scientific evidence to support that there's no link between taking ibuprofen and worsening of COVID or increasing your risk of contracting it. So if you're prescribed those medications, please continue to take those unless you're directed by a healthcare provider to stop that. The second class of medications that it's important to talk about are heart medications. So again, early on in the pandemic, there were some reports that are out there that were presented that some of these medications called ACE inhibitors or ARBs, examples would be things like lisinopril, enalapril, losartan, could increase your risk of having severe disease or contracting the disease. That also has been shown to have no evidence whatsoever. So the CDC also states that there is no evidence to link these medications to either contracting the virus or making the virus worse. So it's very important that you would continue to take these medications that are commonly prescribed by heart specialists or family physicians or other providers. Please consult with those providers before stopping any of these medications. The third type of medication I wanted to talk about was asthma medications, particularly inhaled steroids, and in some cases oral steroids, which are prescribed when asthma gets worse. It is safe to continue to take these medications, and again, I would caution, please do not stop taking any of these medications without consulting with your healthcare provider. It has been shown to be safe and effective to continue these asthma medications during the pandemic. The one thing that we do need to caution about with asthma medications is if you are tested positive for COVID-19 and you are prescribed a nebulizer, that you can continue to use the nebulizer. However, it is recommended that you use the nebulizer machine in an isolated area, either outside, such as on a patio or a porch or in a garage, if you have those facilities available, or in a room away from others. And the reason for that is that the virus can become what is called aerosolized, which means get into the air by using a nebulizer machine. So it's not going to cause harm to the person who is infected with COVID-19. However, if there are other family members that are present or other persons in your household, it would be important to isolate yourself while using that machine. Another thing I wanted to mention was that there is no proven effective treatment for COVID-19, although there are several things that are being currently studied, such as antiviral medications. However, there's no scientific evidence yet of an effective treatment. There have been several things reported that are possibilities, including a drug called hydroxychloroquine or Plaquenil. However, it has not been demonstrated that this has any effect on shortening the length of the disease or decreasing the severity of the disease or curing the illness. So if you're prescribed this medication, of course, continue to take it. But if you have not been prescribed this medication, please do not take others' medications that they have been prescribed. This particular medication is also found in other products, and it is not for human consumption. And we've actually had reports of deaths of people consuming hydroxychloroquine. So please do not do this. It has not been shown yet or proven yet to be effective against this disease. It could be very dangerous to you. The last thing I wanted to mention was the use of hand sanitizers and disinfecting products. Please do not use these in a manner they were not intended. Do not ingest them or inject these products internally. That would potentially cause great harm and death. So only use products as they were intended. So there's a lot of information out there. It's sometimes hard to differentiate what is true and what is not. So I would recommend that you consult the CDC website, the Illinois Department of Public Health website, the Macon County Health Department website, or you could also visit the SIU School of Medicine Center for Family Medicine Decatur Facebook page for more information. Thank you for your time today. I hope this was useful, and stay safe.